Alex,
Me.
you okay? You seem a little upset.
I went to the doctor last week and told me I had some abnormal results.
What type of abnormal results?
Some swelling and tenderness on my gynecological exam. They want me to go back for other tests.
When do they want you to go back?
Wednesday. Do you want to come?
Yeah, I'll come with you if you need me to.
Thanks.
Come in.
How you doing today? So I'm Mike. I'm going to be your nurse. Can I get your name and date of birth, please?
Alexandra Torquato, March 2nd, 1995.
Okay.
This is my cousin Joe. Is it okay if he stays for support?
Yeah, as long as it's okay with you.
Mm-hmm.
Okay. So, you did test positive on the test CA125, so that isn't a direct indicator of ovarian cancer, but it does mean that there is a disease present. So, what we can do is take some additional tests, a possible CT scan, and also a possible biopsy for the doctors to examine the tumor under a microscope. Is that okay?
Yeah, I guess so.
Okay, so do you have any questions?
If I do in fact have ovarian cancer, what kind of treatment can I expect?
So surgery is a possible option, but we do have medication to target the cancer's growth.
What kind of medications could she expect to be taking? Because that seems like the more reasonable route than invasive surgery.
Yeah, so that's going to depend on the outcome of the testing done. So there is surgery, like I said, but we also do have a medication called Bleomycin, which I have right here. So what Bleomycin is an anti-tumor antibiotic that's used to treat cancer. So this drug is cytotoxic, which means that it is going to also be harmful to your normal body cells. So Bleomycin has shown to have anti-tumor activity, which selectively inhibits the synthesis of DNA. So in layman's terms, it's going to bind to the cancer cell's DNA and prevent it from growing or dividing. The purpose of it is that it's going to take the cancer cells and keep them from growing. The route, typically it will be used with other cancer medications and can be given IV or by injection into the muscle or under the skin. So to prepare the solution, we're going to do it in a biologic cabinet. We're wearing gloves, a gown, mask, with handy medication and discard equipment into specially designed containers. To prevent errors, prior to administration, clarifying all ambiguous orders. I'm going to double check single, daily, and the course of therapy dose limits. I'm going to have a second practitioner independently double check original orders and dose calculations. So do you understand?
Yeah, pretty much it's going to kill the cancer cells.
Yeah.
So what you're saying is that Alex is going to be started on chemotherapy. I've seen what chemotherapy can do to people. What are some of the possible adverse reactions we can expect from this medication?
So if we end up going with Bleomycin, if you do have ovarian cancer, you're going to notice some generalized weakness. So some other complications may include fever, chills, some skin reactions, possible redness, darkening of the skin. You're going to want to make sure to check out your nail beds, check for thickening or nail banding, and you're also going to experience some possible hair loss. But the main complication of Bleomycin is going to be pulmonary fibrosis. So Bleomycin is cytotoxic, so as long as it's killing the cancer cells, it's still going to affect your normal cells, which could be toxic to your lungs. Come in. Oh, hi, Kevin. I was just explaining to them the adverse reactions of Bleomycin. So.
Okay, well, hello everyone. My name is Kevin and I'll be your respiratory therapist. Can I have your name and date of birth?
Alexandra Torquato, March 2nd, 1995.
Okay. So I understand that if your definitive diagnosis is ovarian cancer, you'll be placed on Bleomycin. As your respiratory therapist, I'll be monitoring your respiratory status while on this medication therapy. So certain things that I'll be monitoring for is dyspnea, which is shortness of breath. And periodically, I'll be auscultating or listening to your lungs for any abnormalities such as crackles. We will also be conducting x-rays periodically as well, so prior to you starting the medication, as well as on a weekly basis. I would like to inform you that pulmonary complications tend to happen normally in geriatric patients, which are patients who are over than 70 years old or who have taken over 400 units of the medication. While on this medication, pulmonary complications normally tend to happen between 4 to 10 weeks while on the medication. If this tends to occur, then we'll stop the medication and have an alternative treatment. Do you have any questions?
No, it sounds really scary though. What are the odds of my lungs completely giving out?
Oh, good question. So, just to inform you that all medications have side effects. And bleomycin is actually a toxic drug that kills cancer cells. So we will do our due diligence to continuously monitor you. So we will conduct a full assessment of your current medical history as well as your past medical history. We will check for any allergies, and we'll also conduct several tests such as a metabolic panel, just to see if you have like any contraindications or any allergic reactions to the medication. And obviously we'll be here for you every step of the way. If you have any questions or concerns, you can feel free to ask us at any time.
What are some things you guys do on your end to prevent complications, such as giving too much or not enough, or if she can't tolerate the treatment?
Well, that's also a good question. So before starting her on this medication, we'll give her a testing dose. So the testing dose is about 1 to 2 units of the medication, and we'll monitor you from 2 to 4 hours to see if you have any anaphylactic reactions. You'll also be pre-medicated on acetaminophen, which is obviously, as you know, something that you can buy over the counter as Tylenol. You'll also be on corticosteroids as well as diphenhydramine. So these types of medications are for to alleviate any drug allergic reactions or to reduce any fevers as well. We would also, as I previously mentioned, continuously do our thorough assessment just to make sure that we'll decrease the chances of any unnecessary risks. Also, to avoid any medication errors, we would obviously clarify and double check the orders. We'll clarify the dosage and make sure that it's an appropriate therapeutic dose, and we'll also have another practitioner making sure that they check the order as well as the dosage calculations before giving it to you.
Sounds like you guys know what you're doing. This has been informative. Thank you. How are you feeling, Alex?
I'm overwhelmed. I don't know if I can do this.
You can definitely do this.
So during the course of the treatment, it's important that you notify us if you're experiencing any of these complications, such as fever, chills, diaphoresis or excessive sweating, shortness of breath, nausea and vomiting, because we may need to stop the treatment if it's too severe. And we also can give you some medications for the nausea and vomiting. You need to let us know if you're having any pain or difficulty swallowing, because then we can give you some pain medication for that. You really want to make sure not to smoke, because it could worsen the pulmonary toxicity. Because of the possible hair loss, you guys might want to look into seeing a wig, right? And if you're taking any multivitamins, herbs, or any extra supplements, we need to be informed of that as well, okay? So to make sure that you guys have a proper understanding of the treatment, I'm just going to ask you a couple questions. Is that okay? All right, so what do you expect from this treatment?
Bleomycin is a cancer drug. It kills cancer cells and normal cells. I might have some allergic reactions or lung reactions, and I might lose my hair.
Okay, so when would you notify us or raise concern about any of these complications?
If I had fever or chills, excessive sweating, difficulty breathing, or just general discomfort.
Okay. All right, so it seems like you have a good understanding of the treatment that you're going to be going under. And I really can't imagine how difficult this must be, especially it's a lot to hear right now. But rest assured, we'll be with you guys through every step of the process. And if you guys have any questions, I have a pamphlet for you, and you can flip through it and let me know if you have any questions. Okay.
You're Catholic, aren't you, Alex?
Yeah.
So her religion is a big part of her culture. I've seen that some hospitals provide pastoral care. Is that something that you guys do here as well?
Yeah, so I understand that spiritual guidance is a very important part of treatment, especially for those who are religious. We do have a priest on the premises, so I can definitely set up a meeting between the two of you guys, whatever you need.
That sounds very helpful. Thank you.
Yeah, of course. Great. Is there anything else I can help you with?
No.
I think we're okay. Thank you.
All right. Yeah, of course.